Thank you, Mr. Speaker. Mr. Speaker, I would just like to requalify some of the previous speaker's remarks. Mr. Speaker, I recognize that any changes in the proposed program could potentially impact up to $5 million in rebates. That was certainly contained in the note. I'd like to point out two additional facts, however. That's less than half of the proposed loss last year because of changes in the programs and changes in other associated costs. Last session, many members might remember that there was opposition to the $11 million in rebates loss. However, Mr. Speaker, the fundamental piece that goes into the cost equation is still not being evaluated, in my opinion. While the Department of Public Welfare and many of the other areas, as they wrestle over the different sections of the budget, one of the things that happens, Mr. Speaker, when individuals who need mental health medications are not given access to them is that they, in fact, can decompensate, and they may end up in the emergency room. They may end up in a setting, in an alternate setting that provides care. Many times, and we heard a report this morning in the Judiciary Committee regarding the status and the types of mental health patients that we have in our prison population. Mr. Speaker, if individuals don't have proper access to the medications that they are prescribed, there's a real increase or a real threat of an increase regarding how those individuals are cared for. And Mr. Speaker, that's my concern. It's been the concern each of the last three sessions as we worked on this piece of legislation. The real number doesn't take into account how those individuals are in fact accounted for, so to speak, in the Department of Public Welfare's budget. Mr. Speaker, the answer for that is very simple, because corrections is corrections budget. You know, other costs associated with that would not show up in that budgetary silo. Therefore, Mr. Speaker, I think as policymakers, we should take a more holistic view. We need to ensure that individuals who need access to mental health care, in fact, can get it. And specific to the psychiatrist exemption, Mr. Speaker, that was selected for a specific purpose. They have the highest rate of approval for that subset of pharmaceuticals that are being prescribed. So in essence, we're re-verifying something that they are already prescribed and spinning our wheels, delaying treatment, and inadvertently increasing cost, in my opinion, to give them a medication that will likely be approved anyway. For those reasons, Mr. Speaker, I would encourage us to take a look across the departmental budgets, understand the fiscal impact specific to the Department of Public Welfare budget, but also believe that we have to look at the impacts elsewhere, whether it be the Department of Corrections or other increased medical assistance costs related to the lack of access. And for those reasons, Mr. Speaker, I would respectfully disagree and encourage an affirmative vote. Thank you.
Chair, thanks, gentlemen. Recognize